gums are firm, pale, pink, and fit tightly around the teeth. As we can see in this picture, the gum is tightly hugging the teeth with a great consistency throughout the mouth. This is our ultimate goal when visiting our dentist or hygienist and performing good oral hygiene at home. An excess of melanin, which is the stuff that makes your skin darker in the body, is typically what causes black gums. People with darker skin are much more likely to have black gums because they naturally have more melanin in their bodies. Dark gums are not a sign of disease. This picture shows a healthy mouth. In this diagram, on the left side we can see inflammation, redness, detachment, and swelling, which indicate the presence of the gum disease. On the right hand side, we can see healthy gums that are pink, attached, and firm on the tooth. As we can see in this picture, there's redness, inflammation, swelling around the teeth. In this case, the person may bleed when brushing and flossing. Signs and symptoms of gum disease include swollen or puffy gums, dusky red or dark red gums, gums that bleed easily when you brush or floss your teeth, bad breath, receding gums, tender gums. Gingivitis is common and anyone can develop it. Factors that can increase your risk of gingivitis or gum disease include poor oral hygiene care habits, smoking or chewing tobacco, older age, dry mouth, which also known as xerostomia, poor nutrition, including vitamin C deficiency, certain medications, hormonal changes such as pregnancy, and genetics. Last but not least, medical conditions such as certain viral and fungal infections.
The mouth is a window into the health of the body. So now let's talk about how oral health affects overall health. Gum disease is associated with an increased risk for developing heart disease. Poor dental health increases the risk of a bacterial infection in the bloodstream, which can affect the heart valves. People with gum disease are 2 times more likely to die from a heart attack. When it comes to gum disease and diabetes, we're talking about a two-way street where one directly affects the other one and vice versa. A combination of gum disease and diabetes increase the risk of premature death by 400 to 700%, according to the American Academy for Oral Systemic Health. Gum disease and bacteria presence in the mouth promotes inhaling bacteria into the lungs that may lead to severe lung conditions such as pneumonia, emphysema, chronic obstructive pulmonary disease, and chronic bronchitis. Gum disease leads to many pregnancy complications. According to the American Academy for Oral Systemic Health, pregnant women with gum disease have only 1 in 7 chance of giving birth to a healthy child of normal size. In a study conducted by Science Advances in 2013, scientists found that bacteria found in the mouth that causes gum disease can move from the mouth to the brain. Once in the brain, that bacteria releases enzymes that can destroy nerve cells, which in turn can lead to memory loss, dementia, and eventually Alzheimer's. Many factors influence the increase of cancer risk. However, gum disease increases the risk of mouth, throat, stomach, and postmenopausal breast cancer. In order to lower the risk of the previously mentioned systemic conditions, visit your dentist for annual exams and follow the suggested cleaning and recare intervals. Thorough oral hygiene can improve the quality of life. So let's find out next what we can do at home to keep a healthy mouth.
Let's talk about toothbrushing. To effectively remove plaque, make sure your toothbrush bristles are at a 45-degree angle towards the gum line. Move the brush back and forth using short and gentle strokes. Follow this up with a sweep of the brush away from the gums to remove plaque, bacteria, and food particles from beneath the gum line. Make sure you are not missing any tooth surfaces. For the backs of your front teeth, hold your toothbrush in a vertical direction using a gentle up and down motion. Don't forget to brush all of the biting surfaces of your teeth as well. using a scrubbing motion. You should brush your teeth at least 2 times per day for a total of 2 minutes each time. An extra soft or soft bristle toothbrush is recommended. It is also important to replace your toothbrush every 3 months or when the bristles start flaring out. Now let's talk about flossing. To properly floss, take an 18-inch section and wrap it into a short piece you can control. Make sure you are hugging each tooth, making a C shape with the floss around the fronts and backs of your teeth. Gently wiggle the floss up and down 5 to 6 times before moving to the next area. Flossing is very important because toothbrushing alone does not effectively remove plaque, bacteria, and food particles from in between your teeth. You should floss at least 1 time per day.